Hey guys, so I just wanted to give you an update on my surgery. I had my surgery yesterday morning. It was for a bilateral cyst removal. So I had cysts on both ovaries, complex cysts. Well, my doctor called them complex cysts, which just mean that they're filled with fluid as well as solid material. But the ultrasound tech called it specifically a dermoid cyst, which basically means the same thing. It's kind of gross if you Google it if you want. It's nasty looking, but they tend to have hair, teeth, skin, that type of stuff inside the cyst. I know it's kind of horrifying. But anyway, so I had those on both ovaries, and so that's what I had removed yesterday because they were large and yeah. So I went in the morning and they had me change into, the hospital gown. They gave me pajama pants, socks, and a robe. And then I kind of just waited in the little family waiting area with Neil and Ian. We watched some Sesame Street, and then around 8 o'clock they took me back and they gave me an IV, and unfortunately I had to have it in my hand. I don't know if you guys can, yeah, that's where my IV was. And the hand ones are not fun, but they said that for this particular surgery it had to go in my hand. And then I also had to have another poke, I don't know if you can see it, on this hand to draw blood for something. So I was nervous about the hand one because in the past I've never really had success with doctors trying to get blood or anything else out of my hand. I have really tiny veins as it is. And so, yeah, so I was really nervous about him trying my hand because the hand is already a lot more sensitive than the elbow or the inside of your elbow. And I just thought he was going to have a really hard time doing it. And he was like, I'm sorry, this is really going to hurt. And so I was like shaking a little, but it did hurt, but it didn't hurt that bad. It was okay. It was pretty bad, but it hurt a lot less than I actually thought it was going to hurt, so that's good. And then the anesthesiologist came in and he gave me something to calm my nerves. And what else? My doctor came in and kind of just went over again what she was going to be doing. She said that I was going to have 3 incisions, one on each side of my lower abdomen, or well, I guess like where your ovaries are, and then one in my belly button. I actually ended up getting 4. When I woke up I had 4 incisions, but that's okay. And so they wheeled me back to the OR. I remember being wheeled into the OR, and I don't remember getting from one bed to the other, but I remember being on the OR table and them asking me to make sure that I was centered, and then that's the last thing I remembered. When I woke up, I had the same nurse that I had from my DNC, and when I woke up, I just remember like I had an oxygen mask on, and I tried like smack it away, and she was like, no, don't do that, and I kept trying to smack it off, and then I just started to dry heaving. I was really nauseous from the anesthesia. I didn't get nauseous last time when I had my DNC, but I got nauseous this time. So I'm thinking it's just because with my DNC I was under for a very short amount of time, whereas this time I was under it for 2 hours. So I just got nauseous. And oh my gosh, let me tell you, dry heaving when you've just had surgery on your like lower area, ow. I didn't actually throw up, I was just dry heaving, but it was really painful to do that. And so she gave me something in my IV to take the nausea away, but I fell right back to sleep because I was still really heavy under the anesthesia, pretty much. And then I woke up a second time and I was still nauseous, so I started dry heaving again. So then she gave me another type of anti-nausea medicine, and then I passed out again. And then the third time I woke up, I wasn't nauseous anymore, so that was good. And Neil was back there as well as Ian, and then they wheeled me into a different room to recover, and yeah, and then they pretty much just kind of went over my discharge and everything, and I was able to, I had to pee. They made me pee because I had a catheter, and my throat kind of hurts and it's pretty scratchy because I had a breathing tube. But other than that, I got to go home, and it does hurt. I'd say on a pain scale, it's about a 5 maybe. But they did give me some pain meds. I guess I can show you my scar. Oh, sorry. I still have the ugly hospital underwear on, but okay, let's see here. Okay. So, I'll show you. So, I got one here on my left, one here, one in my belly button, and then one here as well. So they're pretty small, and it just really, really hurts. I feel like a 300-pound sumo wrestler kicked me in my gut a few times. But yeah, they told me that I should be feeling better in a couple days, so looking forward to that. And also they put me on birth control, which I'm not very happy about. And they didn't really explain to me why I needed to be on birth control. They just kind of gave it to me and told me I had to take it. She told me I needed to take it for 3 weeks. But the little paper they gave me on like when to take all that kind of stuff, it actually tells me to take it for 3 weeks, skip the placebo, and skip right to the next pack. So I don't know whether I'm only supposed to take it for 3 weeks, or which is what the nurse told me to do, or if I'm supposed to follow the paper that she gave me, which tells me to go to 2 packs. So I do have a follow-up in October, the beginning of October, which is around that 3 week. I'll just ask her then. I don't really want to be on birth control, but my godmother had complex cysts removed when she was around my age, and she said the reason they put her on birth control was just to get rid of the simple cysts. They just removed the complex/dermoid cysts from me, but they did not remove the simple cysts because it just wasn't necessary. They tend to go away on their own, and birth control can help take away cysts. So my godmother says that was one reason, was to get rid of the remaining little small cysts that didn't need to be removed surgically. And also, I guess they just want your ovaries to rest, because obviously ovaries ovulate and because I've just had surgery on them, I guess they just want them to rest and not ovulate for a little while, and that makes sense. So I just wish, I guess the nurse had explained it to me, but she kind of just told me to take it. So I'm just going to go ahead and understand it the way my godmother told me for now, and then when I have my follow-up, I will ask my doctor if that is the reason. But I was really hoping to, you know, just as soon as I'm healed up, to get back trying to conceive again. And so I don't really want to be on birth control pills for 2 months, but you know, I'm going to do whatever the doctor needs me to do. But yeah, I'm going to ask her at my next, or at my follow-up appointment, if it's necessary that I still take them after 3 weeks. I guess other than that, I am okay. I'm feeling okay. It's just really, really sore. My lower area, obviously, it's just really, really sore, and my throat, like I said. But yeah, I'm good. The surgery went well, and yeah, I'm home now, so I got to come home the same day, so that was good. I went in at 7 a.m. and I got to come home around 2:30 or 3-ish, so not too bad. And my fingers are really fat. Like, well, they're fatter than they normally are. Like, my hands are swollen. It like took me a while to get my ring on today. I don't know if that's normal, if your fingers are supposed to be like that, but anyways, I'm home, I'm okay, and I just want to let you guys know, thank you for all the prayers and well wishes that you sent me. I really appreciate it, and they really, really helped. And I will continue to update you as the days go by. I also am going to be filming a Citrus Lane unboxing. I purchased a Citrus Lane box for Ian this month, and I got it in the mail yesterday, so I'm going to go ahead and do a unboxing so you guys can see what's in the September 2014 box. And yeah, I will talk to y'all later. I hope you're doing well, and bye!